this health talk series, which is an initiative by Mr. Shrenik sir. I would like to take the privilege of requesting Mr. Shrenik sir to introduce about Dr. K.Hari Prasad. Over to you, Shrenik sir.
I have this privilege when Dr. K.Hari Prasad, President of Apollo Group of Hospitals and a pioneer architect of founding the emergency medicine in India. And sir, we are really so much grateful for joining us on this platform. This is our fifth episode, and your presence itself will be an amalgam by your talk. It will be shaping our marathon from Jaggesh to Brogesh, and we love to move it at the speed of Adani Express. So thank you very much once again, and welcome to our platform. Last but the least, my sincere congratulations for leading Apollo Group of Hospital and especially for getting recognized as the first rank under the Times to survey this year. So many congratulations and very warm welcome once again.
Thank you very much. It's always a privilege to be on your platform. I've seen your earlier episodes. They're extremely passionate and emotional, and I'm looking forward to chat with you and see what we can give the audience.
Yes, sir. Please, Aravi, over to you. Kindly move on with Dr. Sir.
Lot for joining in. Dr. Hari Prasad ji, we want to hear your journey with Apollo, and then what are the changes, and what is the, I mean, how is it that Apollo Hospital and the group is transforming with the new changes in the hospital industry?
I am a strong believer in destiny, and I guess the belief is stems out of the fact that my own life is passed through different journeys, and finally it is reached where I am today. My father was a doctor. Was a doctor, and he had one of the largest nursing homes in Hyderabad. And as I was growing up, I always believed that I would become a doctor and take care of the nursing home after my dad expired or retired. And that's how I was brought up. And I did finish my medicine, did my MD post graduation, and then came and joined my father's practice. And I was practicing there for 3 to 4 years. And then Dr. Reddy, our chairman, who sees far beyond any of us can see, whose vision is far ahead of any one of us, called me sometime in 1996 and said, emergency is a major specialty in the developed countries. One of the things I came back from the US to do in India was to bring Indian healthcare on par with the best in the world. And emergency medicine does not exist in India. And a lot of people are dying because of the lack of proper emergency medicine as a specialty in this country. And that includes the people, which are the doctors, the technicians, the nurses, the infrastructure, both within the hospital and outside the hospital. So I want you to take on this challenge and create a specialty in this country. I told him my dad has this nursing home, and the family all looks up to me for taking over the hospital at some point of time and running the nursing home. That's when Dr. Reddy said, "See, if you to work at your hospital, you will be doing great work for a small segment of the community in that local area. But if you do come up and join Apollo and take on this challenge, you would be serving a much larger community and touching many more lives across the country. So I think this is a great opportunity for you to take on. These were the words which changed my mindset. Until then, I was under the impression that I would be continuing in that nursing home of my father. But once Dr. Reddy said this, I started thinking about it very seriously. And then I believe that if I continue to work in nursing home, there will be a stagnation very soon, and that is what I will do for the rest of my life. But if I move on and join Apollo, there is a lot more that I can do. So that's how I joined Apollo initially. And at that point of time, there's nothing called emergency medicine. So what we did was we launched India's first dedicated accident and emergency hospital in Hyderabad. 50 small facility, 50-bed facility, but completely equipped and capable of handling any emergency. And what we did was we formed a team with people and colleagues, like-minded people from across different specialties, formed this emergency team. And we did not have ambulances, and in those days, most of the ambulances were meant for carrying dead bodies rather than bringing in emergencies, which the primary purpose of the ambulances is. So we actually created a prototype of an ambulance, went and sat with the fabricator, got an ambulance fabricated, and once we got that done, we believe that emergency medicine uh, states very clearly that the care should begin from the point where the patient is first seen. It could be a road traffic accident. The patient's treatment should start on the road at the site of the accident. If it is an heart attack, if they're taking a patient from a house, the treatment should start at the house, and it should actually go through while the patient is being transported to the hospital. And the hospital should be actually prepared to receive the emergency and take on the emergency. So once we got the prototype of the ambulance ready, we realized that we did not have the people who would go in the ambulance and bring in the emergency patients into the hospital. So we decided that we as doctors would become the paramedics for a period of time till the emergency paramedics were trained. And we used to go in the ambulances and pick up patients and start treatment on the spot during the transport, and then bring them into the emergency hospital and started treating them. And within 3 to 6 months, the hospital was jam packed, and people were starting to look at something new, something different, and something which was producing results which India had never seen before. So within a year, Dr. Reddy said, "See the difference that you're making in the field. Now you need to take it across other hospitals because this is what is required for the country." So then I gradually started working on other hospitals in the group. First, the Apollo Hospital in Hyderabad. We created a network and then created the ambulance system. Then we took across all the hospitals in the Apollo system and created what we call the National Network of Emergency Services. And in those days, there was no number which a patient could call when there was an emergency. So we actually went and worked with the Telecommunications Department, Ministry of Telecommunications in the Government of India, and got a four-digit number called 106, which just continues to be our emergency number. And depending on the location from where you call, the nearest hospital would be triggered off and the ambulance would be sent and picked up and brought to the hospital. Now, that was the beginning of emergency medicine in India, and we believed that it was not enough to do it for the Apollo group alone. We needed to make it a movement in the country and establish it as a specialty across the country. So we actually, and there were no training programs, there were no courses, there were no postgraduate courses in emergency medicine in those days. No university offered a program. So we went to the Royal College of Emergency Medicine and tied up with them. and we went to the Stanford University in the US and tried up for the paramedic training with the Stanford University, and started creating a work pool of people who are capable, who are trained, and who are skilled in emergency medicine, who are committed and dedicated to emergency medicine. And I must say, one of the biggest pride for me today is to look back and see that emergency medicine is today one of the most sought after specialties in the country. And we are not only producing emergency physicians for our own country, but a significant number of emergency physicians in the UK who are trained in our system are doing extremely well. So I think we moved a long way. There's still a long way to go on the emergency medicine front. And now the youngsters have taken it on themselves, and we have a society called the Society for Emergency Medicine in India, and they're working very hard to further expand the specialty and to further realize the potential that the specialty has. And this is all for the sake of the common man, to save lives. Because in an emergency, whether it's a heart attack, a stroke, or a road traffic accident, the first hour after the incident is the golden hour. The care that you provide during the golden hour often decides between the death or life of an individual. So optimal care during the golden hour is the aim for emergency medicine, and it is very heartening to see that a number of lives which would have otherwise been lost are being saved across the country, and the governments themselves have taken up the emergency medicine across many states. Like they've put up the 108 emergency services with the ambulance, pre-hospital care services. A lot of our states started creating the infrastructure. So it is with great pride I look back at what is happening, and now the youngsters are taking it forward. And what more do you want when for a program that you started than to see it grow and become really big in the country?
Yeah, I completely agree with you, sir. I personally have a very great experience with Apollo. One of my managers, almost a couple of years back, had she fainted in the, and she's a US client, 55 plus that time. Uh, we moved her into Apollo emergency, and the entire night she was treated with IV, etc., and couple of medicines were taken. Entire night I was there at the Apollo hospital, and the only thing I was focusing on was her wellness and what would be the bill by the morning, because this is a big hospital. And to my surprise, I ended up paying only 350 rupees, I think, and by the end of the morning. And it was to my surprise. I was all worried that whom should I call, and this was a night, nobody at the office was available. And to my surprise, only 350 bucks, including IV, etc. I paid and walked out. This was a couple of years back, but I still take this as an example and share it with many friends of the experience which I had. Because most of the hospitals, as soon as you see a customer or a patient who's not a Indian, but from somebody else, especially if they're from US and all that, the treatment is different. But that also includes some premium and all that. But I've seen a seamless treatment, and the care that was given, and I was surprised definitely by the bill that was received by the morning. And this was
I think
completely
you
emergency.
make a very, I think you make a very good point, because people find the cost of treatment to be extremely expensive, and the perception is that bigger hospitals it is like very expensive. But one needs to understand the fact that the cheapest healthcare is preventive healthcare. And if you are careful with yourself, if you go through your preventive health checks, if you take care of your pre-existing conditions like diabetes and hypertension, and you avoid the complications of the pre-existing conditions, and that is the cheapest form of healthcare. The next thing is early diagnosis and treatment is the next cheaper form of healthcare. But unfortunately, what happens in our country is we really don't spend enough time and resources on prevention, and we always delay. Suppose somebody is having a pain in the upper part of the stomach, they tend to go and say that this is some form of gastritis and take all sorts of things, but actually it is a heart attack. Or if we see a lot of patients coming in the later stages of cancer. Now, always once the diseases become more advanced and the need for treatment also becomes much more, and that is where it becomes more expensive. So the message should be to focus on prevention, focus on wellness, and if there is a condition or if there is an issue or the problem, seek medical advice immediately rather than waste time and let it go to a higher stage, because the more the delay, the more the cost. So it is very, very important to get treated early and get focused on preventive healthcare. And I think the cost of care, you will realize, will be much lower, as you did realize when you came into the emergency room.
Yeah. Thank you, sir. Any points you want to discuss about Apollo spreading its wings not only in India but internationally? Because that's very good to see. Apollo, which was born in Hyderabad, and you have wings across different countries.
Yeah, Dr. Reddy was Prathap Reddy, who was our chairman, who was the founder chairman, was a very successful cardiologist in the United States of America and doing extremely well. He came back to India because he felt that when most of the doctors who were doing well in the United States were Indians. And he felt that if we were able to provide the same environment, the same technologies, same machinery, and the same support systems, why can't the Indian doctors provide the same sort of care that was being provided in the United States? That was his basic reason of coming back, because he wanted the people in India to get the same level of care as elsewhere in the world in the developed countries. And that is how we started the first Apollo hospitals. And very soon that was a very big success, and people from all over the country started traveling to Apollo. Then we realized that we needed to be, the need was much more, and the people requirements were more. So we started more and more and more number of hospitals across different geographies within the country. And as we talk today, we have 72 hospitals across the country, and we have been able to provide access not just in the metros, but a significant number of tier 2 and tier 3 cities and towns in the country. And to create that access, healthcare is all about access. It is geographic access, it is financial access, it is technological access, it is skill access. So it's all about access. So we've been able to create that sort of an access. But I believe there is still a huge need, unmet need in the country, and we are continuing to look at where we need to be present to be able to increase the access for the people. Well, I mean, about 30, 35 years ago, India was a global healthcare seeker. If you remember, people from India who were rich and famous used to go to US to get a heart surgery done or cancer treatment done,
Yes.
while the poor and the middle class used to remain in India and had no access to treatment. So we were a global healthcare seeker. From that, gradually, as we started proving to the world that we are able to provide the same quality of care with the same outcomes at a fraction of the cost, the people from all over the world actually started looking at India for healthcare. Today, we get people from about 160 countries for care in this part of the world, for care in India. And that is a huge transformation from being a global healthcare seeker to today we become a global healthcare provider. You talk about technology, the best technology that is available in the world is available with us. And Indian doctors have always been known to be the best people in terms of skill and efficiency. They are there in the country. Indian nurses have excelled all across the world, continue to excel, and we have them in plenty in this country. So India is today actually transformed into a global healthcare provider, and I think the credit for that needs to go to Dr. Prathap Reddy, who had this vision, and his vision actually, a lot of us have visions. We dream and think of multiple things. But this is one man who has the capability of converting his vision and dreams into reality, and that is what we are seeing at this point of time.
Super, sir. Shrenik sir, do you have a question? Sir, you're on mute. Yeah. So, okay.
Dr. Hari Prasad sir, I would like to talk about three different points. You talked about number one, you have started with destiny, and I must say that the concept of emergency medicine in India, but only that you have had millions of people to save their life and changing their destiny. That is the key factor and catalytic solution you got within India. So that's number one. So number two, uh, you talked about the diagnosis, treatment, and such matters. So we at this platform at WurkTV, this was my intention and idea of bringing that healthcare experts on this platform so that community, the people who come across and know the skill of a specialist and they can read them out in a real time for only diagnosis and timely treatment. So this is one of the key reasons of starting this ad series and again you are being so kind to be on our platform. And last point, I would like to give one more suggestion that uh, just uh, uh, think about or plan about starting mobile radiotherapy because in a small center, small town, small cities, and especially during this COVID time, traveling etc. is really difficult. So yeah, just like ambulance, if you can start mobile radiotherapy one, that will be helpful for saving lives of many.
I think you make a very good point, and this goes back to what I said earlier. This is about creating access, and COVID has actually shown us our deficiencies and difficulties in COVID times in terms of travel, in terms of reaching out and getting to the right treatment. Cancer is a complex disease, it's a multisystemic disease, and has multiple forms of treatment, surgical, medical, and radiotherapy. And one of the important things to remember is radiotherapy and the different types of radiotherapy is on the move. That technology is happening all the time. For example, we have more advanced technology for cancer treatment in terms of radiation called proton therapy, and that is the ultimate in treatment for cancer therapy. We are already doing surgery at multiple places at tier 2, tier 3 cities. We're doing chemotherapy in tier 2 to tier 3 cities, and we're also looking at creating this standalone centers for chemotherapy in smaller places. But radiation is an important thing which is not very easy to create a mobile system because radiation involves first treatment planning, which involves your imaging, your CT scan, your MRIs, and all that images are required. That needs to go to a treatment planning system, and then you need to have the correct area identified, and you need to make sure that the radiation reaches the correct spot because it is a matter of millimeters. Even a millimeter either side could actually harm the healthy tissue and cause more damage to the patient rather than benefit for the patient. So the treatment planning is very important. And the radiation machine itself, because of the danger of radiation or exposure to radiation, there are a lot of specifications in terms of where a radiation machine can be put. And right now, I don't think the government has any regulations which permits mobile radiotherapy. But what we are looking at is increasing the access to radiotherapy units by setting up radiotherapy units in multiple places. Like right now, as we speak, we are now building up, about to inaugurate radiotherapy in Bhubaneswar, in Visakhapatnam, and in Mysore. None of these are metros; they're all Tier 2 cities, and we are now beginning to go there. And we have a radiotherapy in a far-off place in Chhattisgarh, like Bilaspur. So radiotherapy, although we cannot really make it mobile, we are trying to increase the access by increasing the number of units at the different locations that we have and creating standalone radiotherapy centers.
Thank you. Thank you very much, sir. That's really quite interesting. And sir, one more point I would like to sort of briefly is possibility reducing the cost of proton therapy. I know that it is a very expensive equipment system, and in India, only Apollo Chennai got this first proton therapy system. So, if something can be worked out on reducing the cost, maybe more and more people can get the desired treatment when in time.
At the end of the day, we make sure that healthcare in India is sustainable. And it is only sustainable when we are able to create resources, generate resources, which will not only support the current operations, but you would be interested to know that medical technology needs to be replaced every 5 to 7 years. Now, just the proton machine costs about 1,000 crores. One machine costs about 1,000 crores. Now, and that is going to be having a shelf life of 5 to 7 years. And we need to be able to replace it after 5 to 7 years. And we need to be able to create enough money to be able to replace it. There is no point in bringing in a technology for a short period of time and making it an unsustainable effort, because it's the people who suffer if we, at the end of the day, if we don't have the technology. Now, what you need to really look at is compare the cost of what you're getting in India with what you're getting in any other part of the world. Now, you would realize that the cost of proton therapy in India is at least 1/10 of the cost of the nearest country where it is available. 1/10. Now, that is still making a loss for the proton therapy unit. But we believe that by making it at that cost, and if we run the machine full maximum, we would be able to generate enough money to be able to sustain the operations and to be able to create the money to be able to replace the technology as and when it is required. So if you compare it with the cost with any other place in the world where this technology is available, it is much cheaper. Having said that, we are very conscious of the fact that people cannot afford, a large section of the population cannot afford proton therapy. But proton therapy is not the treatment of choice for every cancer. Proton therapy is not the radiation that is required for every cancer. It is about highly specific cancers which are extremely susceptible to proton therapy and where the results are extremely good. So we are making sure that only these types of cancers come onto the proton therapy, where everything which is done yields good results. Right? Yields the outcomes which are, the patient near normal. So that is the second thing. And the third thing is we are flexible in our pricing, especially for those who cannot afford it, and we're trying to make it accessible. But my humble request to everybody who is listening, and I keep saying this all the time, nobody can afford the quality treatment. No country can afford to treat all illness. The only way we can be prepared to, we all believe that we will never get sick, and we all believe that we'll always be healthy. But we know that we're going to fall sick. Some of us may be unlucky to fall seriously, which demands a really high-end treatment. And the only solution to this is to pay that little bit of amount towards health insurance and cover yourself with health insurance. Once again, to the credit of our Indian health insurance companies, the premiums payable for health insurance in India are the lowest in the world. Please take an health insurance. Please keep yourself covered because you do not know when what will hit you. When you buy a vehicle, you will not get the vehicle on the road without the insurance for the vehicle because it is a mandatory thing. Unfortunately, the person who is riding a vehicle and who is likely to get injured it's not mandatory for them to get insured. I think universal health insurance is the need of the hour, and that will help our people to access the best technology and benefit from it.
Yes, sir. I totally agree with you because I'm familiar. I'm aware that proton therapy in Poland itself, that is treatment for one patient is costing between 35 to 40 lakhs. So that is absolutely what we are doing here in India is unbelievable, and that I totally agree with you. And yes, and one more point I have to mention that I would like to say you all doctor or consumer specialist paralegal on behalf of the community, whatever the treatment, what are the skills, what are the expertise and technology make use in India and the there is absolutely no need for someone to go abroad for any treatment. And I salute to all of you for your tireless dedication.
Thank you so much. We will continue to strive and under the guidance of our chairman, we will continue to do what we're doing and we'll try to improve access, we will try to bring down the costs and we will ultimately what everybody aims at is we are working towards the happiness of the community and it is a commitment to work towards the happiness of the community and we will remain committed towards it.
Thank you so very much, sir. We are very much obliged.
Before we end the session, sir, can you talk about the book which you have written, I Am Possible? So we would like to hear that.
Yeah, actually, it was not a book which I had written. I'm a bit of an introvert. So I normally don't talk out about things which are going on with me. So I put everything down on my computer as a small note because everybody needs to have a letter. So I put everything down on a small note. And one day, one of my colleagues saw that note and said, "This is a wonderful book because you've gone through so much in life. There have been so many things which times when things looked like were impossible, but then at the end of the day, it turned out to be possible." So this would be a book where people who are, looking for inspiration, looking for motivation, would be benefited by going through this book. So let us convert it into a book. So I was not really interested, but they actually, my colleague and my son, they took all the notes from the book, gave it to a publisher, and got the book published. And I was really pleasantly surprised by the response to the book because it became a bestseller within the first week of the launch, and over 10,000 copies have already been sold, both in the e-platform and in the physical form. And the feedback that I got was also extremely satisfactory. And I'm happy that it happened because it actually traces a journey right from my childhood. I'll just give you an example. Um, just about when everything seems to be going well, and I was at the peak of something, there would be a deep valley which I would fall into, and then again the climb up would begin. So this happened on multiple occasions, and each time it happened, I managed to come out of it. And just to give you one simple example, I was made the president of Apollo Group of Hospitals in 2016, and I was in the US for a couple of weeks. And on coming back, I'm a diabetic, so they used to get my blood sugar tested every month. And as soon as I came back, my secretary called the phlebotomist and asked him to take blood for a blood sugar test. And within a couple of hours, I got a call from the lab asking me to go to the lab immediately. When I went to the lab, I found the hemato-oncologist and the pathologist there, and they told me that I have blood cancer. And all of you know what it means when it is blood cancer. And being a doctor, I knew the worst that can happen to a blood cancer patient. And I mean, everybody believed that was the end of Hari Prasad, and that was the beginning of the end of Hari Prasad. And I was also, I mean, I knew what was happening. But I went through the chemotherapy. I made sure that the medical knowledge that I had was kept in the background, and I allowed my treating team to do what they thought was the right thing to do. And I was under chemotherapy for about 9 months. And after 9 months, I was told that I was cured of the blood cancer that I had, and again I was back to normal. And the good thing was, I was able to work through the treatment using technology, using teleconferencing, using mobile technology. I was able to work continuously through the 9 months of my treatment. So that's how, when I just reached my peak as a president in my career of the Apollo Hospitals Group, I went into blood cancer and I fell into a deep valley. But then again, I came back up from the deep valley in the form of cure of the treatment. And it has now been 3.5 years after the treatment, and with God's grace, I'm fine. So it is many incidents like this which are captured in the book, and a lot of people found it to be very motivating, and a lot of people could relate to incidents which happened to them in their own lives. And I was happy when they told me that it was inspirational to them.
Sir, I cannot stop clapping my hands.
Superb journey. Thank you for sharing that. Short summary of that particular book, and really inspiring. So, Shrenik sir, anything you want to say before we, close this particular session?
Uh, no, sir, my name is continued on behalf of our WurkTV family, and we would like you to have on our platform once again. And thank you so very much for a very precious time and explaining the change.
Thank you. It's been a pleasure, and look forward to meeting you. And I take inspiration from people like you. You yourself are a great inspiration in terms of how to face adversity and how to be normal within an adversity. Thank you so much.
Yeah, thank you, sir. Thank you for being part of the brand, which is setting a lot of example and becoming the policy maker for healthcare industry with respect to emergency or hospital on wheels. And personally, my regards, because I've had very good experience with Apollo. So yeah, God bless you and the entire team and the brand and the founders who founded this. So thanks a lot again for joining this particular show. Thank you, sir.
Thank you. Thank you. Thank you. Bye bye.
Thank
Bye
you.
bye.